Hello, I'm Dr. Janet Wright here at ACC09 in Orlando, chatting with Dr. Harlan Krumholtz about a new initiative called Hospital to Home. Harlan, what's the problem we're trying to fix?
Hi, Janet. I'm happy to be here. This is really about focusing a bit on this issue of readmissions and particularly transitions from inpatient to outpatient status. This is an issue that, gaining momentum. People are looking at this with a lot more scrutiny. There's a realization that about 1 in 5 of our patients ends up back in the hospital within 30 days after they've left the hospital. And this is a burden to patients. It represents, in many cases, not all cases, but many cases, areas where there are gaps in quality, and it's costing a lot of money. And there are a lot of people looking at this now, and there's a lot of interest, and maybe we're going to try to work together and with our colleagues and friends to try to do something about this.
I think what I've heard is that this is built on the model that you used in Door to Balloon.
Right. So with this sort of increasing appreciation of what's going on around admissions, and the MedPAC, the group that advises Medicare, has focused a lot of attention on this. Obama, even in his budget proposal, has a paragraph in there about readmissions. People are talking bundling payments. Hospitals and cardiologists, practitioners are wondering, well, what exactly should we do about this, and how are we going to make this better? And we started reflecting on the success that we had in Door to Balloon, the idea that we brought together experts, we identified 3 or 4 key strategies, and then made available a lot of resources for people to draw on, and created a community where people could share information. We thought, gee, maybe we could do something like that again, and in a sort of very efficient way, try to spread the news about what people can do to make this better and work together to actually improve care.
Because this is so complex a problem, talk to us about the type of partnerships that will be necessary to make this happen.
Right. This isn't just a cardiology issue, and you know that in a bunch of different ways. The fact is, these people that come back don't just come back for cardiovascular problems. They are often related to a whole range of things around the quality of the care. The cardiovascular problems are central, but we know that our success in helping patients, it has to do with teamwork, putting together teams, reaching across to other practitioners and other groups. So the campaign has to reflect that too. And from the very first, we reached out to the Institute for Healthcare Improvement, or the preeminent quality improvement organization in the country. They've run campaigns also. And so from the very start, it's ACC and IHI. But that's just to get us started. We're already talking to the American Heart Association, the Heart Failure Society. We're talking to a hospitalist society. We're talking to, we'll be going all across the spectrum. We're going to talk to payers, and we're talking to institutions, hospital institutions, and we're going to get nurses involved and a whole range of people. This is not going to be done singularly by cardiologists, but we can help, we can lead, we can work with our colleagues, and I think it'll make a difference.
And just within ACC, our CCA members are going to be instrumental in making a success of this.
That's a really good point. So if you look at the very best care in this transition period, it's not just physicians. It's physicians, nurses, whole range of people across the spectrum of training and expertise and perspectives. And yeah, exactly, we're going to be bringing in the CCAs, and this is going to be the kind of effort that's going to respect different perspectives and opinions and try to figure out what can we do to really get in this and help patients get better outcomes.
Tell us what the initial ask is here, Harlan, in terms of hospitals enrolling.
Right, so like D2B, first thing we want is just a commitment that this is important and that the hospital is going to focus on this. We want teams to be assembled. We want there to be leadership. We want there to be administrative support. We want people to be able to make a verbal, clear, explicit commitment to try to reduce these readmission rates. And in the course of this, we want net for patients to be better off as a result of this effort. So first thing we want people to do is go to the website, ACC website. There's a click to the what we're calling H2H, Hospital to Home initiative, and we want people to join us because then they'll be on a group that'll be able to get information as we run webinars, we post things on the web. They'll learn about this. This isn't going to officially launch until this summer. It's actually going to come out aligned with the release of the measures from Medicare, publicly released from Medicare of readmission rates for hospitals. So as the tension sort of grows, we want to say, we're prepared, we're actually going to do something about this. We're not in a reactive phase, we're in a proactive phase with this.
Great. Thank you, Harlan, for joining us.
Yeah, thank you very much, Jan. Looking forward to working with everyone.
This is Janet Wright from ACC09 in Orlando talking about Hospital to Home.